morning. My name is Samantha. I'm going to be your nurse today. Okay, providing privacy. Hi, my name is Samantha Carbonaro, and I'm in health assessment class, and I'm going to be performing a physical assessment on Jennifer Batista. I'm going to first be washing my hands because washing your hands are the most important thing prior to seeing your client. I'm going to come over and identify my client. How are you doing today, Jennifer?
Good.
Can you tell me your name and date of birth?
Jennifer Batista, 7/20/81.
Wonderful. Can you tell me where you are today?
I'm in Memorial Regional Hospital.
And what's the president?
Barack Obama.
Barack Obama. So by asking her these questions, I just have, she's awake and oriented ×3. I can tell she's oriented because she's here, she's awake, she's alert, and she's listening to me. And I identified her by her name, her birthday, and who the president is, so she knows what realm and time we're in. What's it called? What brings you into the hospital today?
I'm just coming in I've been having some coffee.
Oh, so you're not feeling well. When's the last time you've been to see a doctor or physician?
Probably like 2 months ago.
Okay, so these are questions that I asked to kind of familiarize with the client to see, when she's last been, to kind of see her timeline of like what the care is. So she's been here, so she's relatively healthy. Since then, she hasn't had any issues or problems. No problems are bringing in except for the cough. Okay, wonderful. The general appearance of the client, I can see that she's well cut, she's clean, her clothes are clean, her hygiene is well done, so that's a general appearance. Do you take any medications at home?
No.
No medications at all? No herbal supplements or anything like that?
No.
Okay, no problem. We asked that because we want to know a baseline of where the client is, whether they're taking any kind of hypertensive medications, diabetic medications or such. Have you traveled anywhere in the last 30 days in or out of the United States?
No.
We also want to ask about travel history just in case, she could have a cough, there's a lot of international bugs going around during the traveling, and we can better identify the organism, and the doctor can better identify the organism if we know more or less where they've traveled in the last, 30 days. Wonderful. The next thing that we're going to do is we're going to take the client over to get a height and weight. So as we ask her to please stand, we ask her to walk forward, and while she's walking forward, we look at her gait and make sure that she's not having any problems with her gait, that she's not favoring any one side, and by doing that, she's doing well. We walk her over to, okay, go ahead and step on the scale. Wonderful. And your height, 5'3", beautiful. Go ahead and have a seat. Okay. The next thing we're going to do is I'm going to take the pulses of the patient. I'm going to identify all the pulses that we normally take here, as nurses. The one that was most commonly used is going to be the radial pulse on the side where the thumb. You just put 2 fingers down and usually take it between 60 to 100. You hold for 15 seconds and times by 4, and you'll usually get the pulse. Jennifer's pulse, it's about 70, okay? Another area that's common to take a pulse is also in the brachial. These are, of course, on bilateral sides. You can also take it behind the ear. This is the carotid pulse here. We also, I'm going to demonstrate on myself. We also have the femoral pulse here. We also have the popliteal right behind the knee. And then we have the dorsalis pedis on the front side of the foot, as well as the posterior tibialis behind the ankle. These are all great areas to take the pulse. The most important pulse that we take is on the left side, on the left sternal border, mid-clavicular, between the fourth and intercostal space. We have the apical pulse, and on a female, it's usually directly underneath the breast. For the purpose of the video, we would normally have, Jennifer take off her top, but for the purpose of the video, we are not. We would auscultate that by finding it and then going mid-clavicular down underneath the breast in the intercostal space, and we would take it for 1 full minute, which would then get us a pulse. We do that so we can compare it to the other pulse, such as the radial, and and we can make a better thing to see with any discrepancies. Another pulse that's also on the hand is the ulnar pulse. Although it's very faint, we don't usually use it, but it can be used if necessary. The next thing that we're going to do is we are going to look at the overall skin of the client. When you're looking at the skin, you want to make sure that you Note the texture, which is smooth and soft. You want to note the color, which is, you know, equally pigmented throughout all of her skin. Noticing on her upper chest as well as her arms. You always want to look bilaterally and compare. So noticing you don't want to see any lesions or any kind of bumps or any bruises or anything, because, you know, we would definitely want to note that. Her skin turgor is good. She's well hydrated, so that looks good all the way around. Can I ask you to lift up your pant leg? We also want to look at the legs. At this point, the patient would be in a gown, and we would inspect the entire leg all the way down to the toes, noting if there was any edema or anything like that. If the patient had edema, if they were in any kind of heart failure, or if they, were on diuretics and were not taking them for a period of time. Jennifer has no edema. We note edema by 1+ to 4+, 1 being the least and 4 being the worst. Also with the skins, we want to notice if there's any skin cancer or anything like that. So if we notice any kind of nodule or anything or any kind of lesion, we want to make sure to inspect it thoroughly, and we do that by the ABCDE method. The asymmetry, meaning that it's, you know, it looks complete around itself. The border, meaning that it doesn't go outside of the border. The color, which means that, you know, it's pretty much the same color all the way around, much like a freckle or something like that most people have from the sun. Also, the diameter of it, and also by the evolving size. Typically, we don't like it to be any bigger than a pencil eraser. So doing that, I like to do a little bit of teaching to the client as well. When you're in the sun, especially here in Florida where it's very hot in the summer days, we definitely want to apply at least SPF 50 to our skin, paying attention mostly, you know, to all the important areas around the face as well as behind the ears, and wear a hat. It's very important to take care of your skin, you know, because we are so prone to skin cancers here in South Florida. The next thing I'm going to check is her nails. We're going to be looking at the nails, making sure that there's, you know, they're clear, that they're soft, that there's no ridges or anything, that that there's no deviation in the nail, like a clubbing, which would be 160 degrees, or any spooning, which would be, you know, indicative of having some, you know, type of anemia. Her nails are clean, you know, all of her nails are the same color, all of her nails bilaterally look the same. We're then going to take the finger and we're going to check for vascularity of the nail as well. You take the finger, you press down for just a few seconds and you lift, and that shows the cap refill. Hers are about 2 seconds, which is quick and nice. We call that brisk, and the perfusion is good. And we check them, you know, on all 10 fingers all the way around, which is very important. And we also do it on the toes as well. So you would check, you know, the cap refill of the toe as well. And it all looks good on all 10, like I said, bilaterally. So you would go through. The next part of the assessment that we're going to do is we're going to check out the hair. When the hair is in a ponytail, we're going to ask Jennifer, can you please take your hair out of the ponytail because I need to assess your hair. So could you take it out for me, please? When you're assessing the client's hair, if you don't have on gloves at this time, it's really, really imperative to, you know, have gloves. The hair could have all sorts of different things, such as lice or any kind of, you know, stuff in the hair. So you always want to make sure to put gloves on. It's really important. So at this point, I would wash my hands again, and I would put on a pair of gloves. And when I'm looking through the hair, I'm looking for any, you know, first of all, I'm looking for the color. The color is like a dark brown. You know, she does have highlights, but her color mostly is distributed well. It's a dark brown color. She has no, you know, lice or lesions. Her head is, you know, symmetric. There's no bumps, and there's no, there's no, like, it's distributed well throughout everything. So we're just checking to make sure of everything. And you also want to palpate just to make sure that there's no bruising or anything like that. And Jennifer, it looks very good. Okay, and that concludes our assessment of the hair, nails, and skin and pulses. Thank you very much. Have a nice day.